Welcome to Complete Health with Dr. Mike Rogers. Today we will be discussing the importance of dental health for women before, during, and after pregnancy. Good morning, Dr. Rogers.
Good morning, April.
So we've spent the last 16 weeks talking about various health concerns relating to the mouth. There's a lot of confusion and controversy over dental care during pregnancy. So I was hoping today we can shed some light on this confusion.
All right.
Can you explain how pregnancy is related to your mouth?
There is a direct link between the bacteria in our mouth and conception and pregnancy. And it contributes to not only premature labor, but preeclampsia, which is elevated blood pressures during pregnancy, low birth weights of babies, stillborn babies, miscarriages, gestational diabetes, neonatal sepsis, and preterm births. All of these things can come back to the bacteria in our mouth.
Doctor, is preeclampsia only a concern for the woman during her pregnancy?
No, April, this condition sets the stage for health problems in the future of the woman after she has the baby. There's an increased risk of thromboembolism within the first 4 to 5 years post-pregnancy. She also has 2 times the risk of a heart attack or stroke within the first 10 to 12 years after the pregnancy. She also has an increased risk of acquiring insulin resistance, which is, in essence, prediabetes, and type 2 diabetes somewhere in her lifetime. And many physicians actually recommend that their patients who experience preeclampsia during pregnancy have a cardiovascular risk assessment within the first 3 to 6 months after the pregnancy.
So preeclampsia, you said, was high blood pressure. What about the what was that?
Thromboembolism. It's a thrombus or a blood clot that will form in the vasculature and be released.
Thank you. Is gestational diabetes only a concern for the woman during pregnancy as well?
Likewise, it's something that can create an issue in the future. The elevated blood sugar can feed the bacteria in the mouth and also the bacteria that seep into the bloodstream. This is called an oral bacteremia, and it allows the bacteria to become more aggressive. And it also allows them to increase their growth and their numbers of bacteria. And so it causes a greater risk for preterm births, miscarriages, along with an increased future risk of dental problems from gum disease and tooth loss, as well as tooth decay. Gestational diabetes or diabetes during pregnancy also increases a woman's risk for future cardiovascular risks, such as heart attack and stroke, and also increases their risk for developing insulin resistance and type 2 diabetes in their future as well.
What is neonatal sepsis?
Well, neonatal sepsis is an infection of the baby in the womb. And once it's born, it still has that infection. So what happens is it can actually cause death in the womb of the baby or have a very severe infection after it's born, and usually born early.
Wow, that sounds serious.
It is. Pregnancy can cause hormonal changes in the mouth, and even if you didn't have gum problems before you were pregnant, you can have gum problems during your pregnancy, and the bacteria in our mouth can create this problem and make it worse. It can build and get into your bloodstream and then open a floodgate for problems during pregnancy.
Is there a specific bacteria that's tied directly to these pregnancy complications?
The most prevalent one is called Fusobacterium nucleatum. And
that's a mouthful.
It is. And so that's why we just call it FN. And so from now on through this show, we'll talk about FN as the problematic or the main player in this complication. And what Fusobacterium nucleatum is it's a bacteria that we find in our mouths, and it's prevalent in most people. The thing is in people who are planning on becoming pregnant or who are pregnant, and if they have this, if their immune systems become compromised with a cold, being pregnant, anything can make them more susceptible to an infection, as bacteria is opportunistic, and not only opportunistic, but it allows other bacteria to tag along with it. So it opens the floodgates for bacteria to just go everywhere in your bloodstream.
And during pregnancy, your immune system is compromised anyway because you've got another life inside you, right?
Yes. And the thing is, even if your gums were healthy before, this bacteria, even if you've got it in your mouth, what happens when your gums become inflamed and start to bleed, it exponentially grows, meaning it just flourishes over 100,000 times more just because of the bleeding in your mouth. And so you've got a little bit in your mouth, now boom, your gums are inflamed because of the change in hormones. Now this stuff is all over the place. And it can very easily penetrate into your bloodstream and then wind up in your...
So how does this bacteria in the mouth affect a baby in the womb?
The placenta in a pregnant woman has immune suppression. And so once this bacteria gets into the bloodstream, and if it hits into the placenta where there's no antibodies to protect it, because the body does this so that it doesn't reject the baby. And so what happens is once the bacteria hits that, it can flourish. And so now the placenta can become infected, the amniotic fluid can become infected, and this all now increases the likelihood of inflammation around the baby. And that inflammation, the byproducts of that, can cause all these problems, premature birth and all these other things that we talked about.
That is staggering. So also what I'm understanding is delaying any necessary treatment, whether it be for your gums or any dental problems, could definitely result in a significant risk to you and your baby. Like if you had a bad tooth infection in your mouth, it sounds like it could spread throughout your body.
Yes, it can. Evidence shows that gum disease, whether it be a little bit or a lot, can increase 7 times more likely to have a baby that's premature. This bacteria that we're talking about, the FN, has been shown to pass into the brains of people, which is very difficult for bacteria to get into. It can also cause colorectal cancer if you've got polyps. It's been found in infections, severe infections in the pancreas, in the liver, in every other organs of the body. And so this stuff, if it has the opportunity and it flourishes because of gum problems, even small ones, can just wreak havoc on not only the general population, but also especially pregnant women.
So, Dr. Rogers, I'm one of 5 children, and as you know, and my mother had dentures in her 30s. She always told us it was because of having us. Is this true?
No, it isn't. But most people believe that because they would lose teeth then. But as we discussed earlier, the gums can become swollen and puffy because of the changes in hormone levels in a woman who is pregnant. And so if you've got gum problems beforehand, even though they may not be tremendous, now you add this bacteria and the changes in hormones and the teeth can loosen up and if you can come out. And so that's what they always attributed it to. If you're not eating a healthy, proper diet, full enough calcium for the baby to develop with, then it's going to draw calcium from you as well. And it could come from the jaw as well. So there's things that it can come. It's not a direct link that the baby caused you to lose teeth, but it's a whole bunch of things. You had lost teeth during pregnancy, so it's just an association.
What is tooth decay and how can I prevent it?
Your teeth are covered with a sticky film called plaque. And in that plaque, there are bacteria, not only ones that cause gum problems, but ones that cause cavities. And when we eat foods high in sugars, foods that are carbohydrates that break down easily, or drink sugary drinks or things like that, those things were feeding the bacteria that produce acids, and those acids are what break down the enamel and the tooth structure. So what happens is that bacteria also can get into your bloodstream. That has been found in a lot of studies surrounding the baby, those cavity-making bacteria in the amniotic fluid. And so while the baby's growing and developing within the womb, these bacteria are being ingested, and babies come out now predisposed or already with this bacteria to have cavities. So they're more apt to have cavities or be cavity prone.
That sounds so serious. How can I prevent that?
Normal home care, brushing and flossing, brushing twice a day, flossing, oral rinses that can help with eliminating bacteria, chewing xylitol gum. Studies show that xylitol gum can help minimize that bacteria and the plaque and the acids themselves. And it shows that, and it's been shown to help with prevent decay in kids.
You are listening to Complete Health with Dr. Mike Rogers. When we come back, we'll discuss the importance of visiting your dentist during pregnancy. Did you know the health of your gums can affect both getting pregnant and staying pregnant, and also ensuring you have a healthy pregnancy and baby? Hi, this is April from Complete Health Dentistry, where your health and the health and well-being of your growing baby are very important to us. Studies show that gum problems from very mild to severe can create fertility and pregnancy complications. In our office, we have simple tests to determine the bacteria that could cause these problems, and also ways to treat it if you do have a problem. Going through my pregnancies, I did all I could to stay and keep healthy and to make sure my pregnancies were uneventful. If that's your goal, call us. Set an appointment to keep you and your baby healthy. 570-253-5000, where we are transforming you and your family's health for a lifetime. Dentistry, transforming your health for a lifetime. Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, you mentioned in the previous section that dental problems can lead to premature births and low birth weight. What are the health risks involved in that?
Premature birth can lead to serious health consequences for your baby. Premature birth is the leading cause of neonatal death, meaning the death of the baby within a month after being born, and it could lead to a host of lifelong medical problems, such as improper brain development, cerebral palsy, seizures, chronic lung disease, blindness, and ADHD. Did you know, April, in the United States, in all the developed countries, that the United States is one of the highest risks for premature births?
I did not know that.
Yeah, exactly. It's at 12.5%.
Why is that?
It's a combination of things, April, and here are just a few reasons to name a few. Infections in the mouth, not only gum infections in the mouth, but the tooth infections in the mouth that weren't addressed. And that infection can go through the body and into the bloodstream, just like the bacteria can. Increased maternal age. Women are waiting longer to start their family. Lack of access to medical care, smoking, secondhand smoke, alcohol, drugs. These things can all increase the risk. Not addressing medical conditions prior to pregnancy, such as high blood pressure, diabetes, depression, thyroid conditions. Not eating healthy also plays a big part. And women who are not a healthy weight before pregnancy and don't gain the proper amount of weight during their pregnancy.
So with an increased risk of preterm births and miscarriages due to this poor oral care or oral bacteria infections, the poor diet, lifestyle choices, are there also future medical risks for the mother?
Yes, there are. Women who have miscarried were more than 4 times likely to have a future heart attack or stroke. And with each miscarriage, that's each time, the risk increases by 40% more, leading to 5 times the risk of a heart attack or stroke somewhere in the future. Well, that leads me to my next question, which I already know the answer to, but I thought it's very important that we discuss it. So should I visit my dentist when I'm pregnant? With a resounding yes, I say, because what it is you should have your teeth cleaned every 3 months. So pretty much in every trimester you should come in, because we don't want to see that real nasty bacteria, that FN that we were talking about before, set foot or become a problem and go through your bloodstream. It is safe to have treatment during your pregnancy. And the thing is we want to make sure the whole pregnancy goes without a hitch. The thing that we do in our office is if you do have any medical complications, let us know about it, because we want to stay in constant contact with your OBGYN to make sure that if there's dental issues arising, they're aware of them, just like if you've got complications with pregnancy issues. It helps us knowing it as well.
Dr. Rogers, you really are complete health, aren't you?
Well, thank you.
How about will dental work pose a risk to my unborn baby?
Normal dental work shouldn't be a cause for concern, but delaying needed dental work could be, meaning if you've got an infected tooth or an impacted wisdom tooth or a problem that should be addressed, leaving it go could create an infection or have an infection go throughout your body, which could leave the mother in jeopardy. It could cause problems for the fetus, and it could increase the likelihood of premature births.
That sounds so serious. Can I have x-rays taken during pregnancy?
Yes, the American Dental Association states that it's safe to have x-rays throughout as long as the mom and the baby are protected.
You mean like the lead apron?
Yep, the heavy lead apron. And x-rays are fine. In our office, we use low-dose and ultra-low dose digital x-rays, so we can minimize the exposure, the x-ray exposure, to not only the mom but also with the baby itself.
What about anesthesia or Novocaine during pregnancy?
Yes, Novocaine, local anesthetics have been proven to be safe, not only for the mother but also for the growing fetus.
So I know you touched on this a little bit, but what if I'm just planning to get pregnant?
If you're planning to get pregnant, have your teeth cleaned at our office and take care of any dental concerns before you do get pregnant. Meaning address gum problems, address tooth problems that can lead to more severe problems in the future, such as infection or tooth breakage.
So by doing that, like you said before, it definitely will lower the risk of having a dental emergency during your pregnancy.
Exactly. Take care of it before the problem arises.
You are listening to Complete Health with Dr. Mike Rogers. When we come back, we're going to talk about your recommendations for the new mom and the newborn.
Complete Health Dentistry.
Healthy teeth and gums for a lifetime? How important is it? At Complete Health Dentistry of Northeastern Pennsylvania, that is our focus. If your mouth isn't healthy, your body can be affected as well. Gum disease has been linked to heart attacks, strokes, and diabetes. And if your teeth and gums are in bad shape, it affects your ability to smile, eat, and live life to the fullest. You've worked hard. Isn't it time to take care of yourself? Turn to Dr. Michael Rogers at Complete Health Dentistry, where you and your health are our number one focus. Take time for your health. Call Complete Health Dentistry at 253-5000 and schedule your new patient experience today. See how we can help you feel and look better than you ever thought possible.
Complete Health Dentistry. Transforming your health for a lifetime.
Visit us on the web at Complete Health Dentistry of NEPA.com. Welcome back to Complete Health with Dr. Mike Rogers. Dr. Rogers, can I do anything to help ensure that my teeth are healthy during pregnancy?
Yes, you can. I'm just going to run through a list of things here, April. Be sure to follow a good diet. Avoid refined sugars and high-carb meals, which can promote tooth decay and breakdown of teeth and increase gum disease. Eat foods high in vitamin C to strengthen your gums. Drink water or low-fat milk instead of juice, fruit-flavored drinks, or soda. Drink plenty of water throughout the day, especially between meals and snacks. Eat fewer sweets like candies, cookies, and cake. Look for products with xylitol, such as chewing gum or mints. Meet all of your calcium requirements to keep your teeth and bones strong and healthy. Brush and floss regularly, at least twice a day. If you cannot brush your teeth because you feel sick, rinse your mouth with water. Replace your toothbrush every 3 to 4 months, or if they become frayed, the bristles become frayed. Monitor your dental health on a daily basis. If you notice your gums bleed easily, they're red, they're swollen, they're tender, the gums have pulled away from the teeth, things are getting caught around them, a persistent bad breath or bad taste, contact our office. Brush your tongue or scrape your tongue in order to reduce the amount of bacteria, because a lot of people miss that in the roof of their mouth. Visit our office to help keep the start of your new baby's life and your health under as best as it can. It's safe to have dental care or dental treatments throughout the pregnancy. As I said earlier, I recommend each trimester through your pregnancy.
So make sure you don't put it off until after you have the baby, right?
Correct.
Now, you touched on a little bit if you morning sickness or if you feel sick. Can you tell our listeners, what if you do have morning sickness? What are your recommendations there as far as the health of your mouth?
My recommendations there would be rinse out as soon afterwards as possible with water at least. You shouldn't brush right away because those acids are very strong, and brushing could cause them to erode the enamel even quicker.
But you can rinse right away.
You can rinse right away.
Okay.
The other thing would be to make a mixture of, say, a cup of water with a teaspoon of baking soda and rinse with that. The baking soda can neutralize
those acids,
the
right?
acids. Exactly.
Okay. So after those recommendations, what about recommendations for mom after the baby is born? I'm sure all of those recommendations you just mentioned apply, but are there any additional things that you would like to recommend for a mom just having a baby?
Continue taking care of your mouth after your baby is born. Proper home care, brushing and flossing, proper dental visits, making sure everything is healthy and strong, good home care habits, good oral hygiene, eating proper foods again, not going to those acidic foods or the high sugary content foods.
And what about the baby? Once the baby's born, what are your recommendations for the baby?
Well, breast milk is best than any other kind of liquids. Germs can pass from your mouth to the baby's mouth. So use a different spoon to taste your baby's food because the bacteria in your mouth can very easily be transmitted. Wash pacifiers with soap and water. Do not use your mouth to clean it off.
Oh, I always did that, especially if I wasn't around the sink.
Do not put your baby to sleep with a bottle filled even with breast milk. Formula, juice, sugary drinks like fruit-flavored drinks or soda. Don't ever do that.
Why is that, doctor?
Because once again, they've got the bacteria that are there. So as you start giving them these liquids to fall asleep with, that bacteria is growing, it's proliferating, it's getting more and more. So when their teeth come in, those cavity-making bacteria are already set in place, and they've already now have a job to do, which is break down your baby's teeth. And many children end up with a condition known as baby bottle syndrome, which is severely decayed baby teeth.
So going to bed with a bottle causes cavities ultimately.
It can increase the risk of cavities, exactly.
Okay.
Wipe your baby's gums before bed. Feed your baby a healthy diet. Bring your baby to the dentist at the turn of a year. It's also good to bring your baby in with you for your checkups so that they can get used to the surroundings and the sounds even early on and see that it's not an intimidating place to be.
I love that when moms bring their babies in and like the toddlers and young 2-3-year-olds, we give them for rides up and down in the chair and whatnot, and in hopes that they enjoy coming to the dentist and don't regard it as a scary visit.
Mm-hmm.
So.
Exactly.
Can you tell our listeners what you do in our office to help women who are trying to get pregnant or are pregnant or even recently had a baby?
What we do in our office is we evaluate the plaque right there on the spot. We can check that using a microscope. We evaluate the gums to rule out any gum issues. We can address decay and infections that are there so they don't become worse. As I said earlier, we want to evaluate all of these things before you're pregnant, because then we can address it without the complications of the pregnancy. We also do a specific test, a saliva test, to look for that really bad bacteria we talked about at the beginning, that FN, Fusobacterium nucleatum, because all of the things that we've discussed come from bacteria in our mouth that can penetrate into our bloodstream and create problems not only elsewhere in the body, but specifically, right, with the growing baby.
Are there other concerns in pregnancy that you believe women should know about?
The condition I want to add to this whole discussion is a condition called polycystic ovarian syndrome, PCOS. And this is created by a hormone imbalance causing ovaries to become enlarged due to many small cysts. This problem increases the likelihood of insulin resistance and type 2 diabetes. And it's not just the women that have PCOS. The interesting fact here is that brothers of these women are also at a higher risk for insulin resistance and type 2 diabetes as well, somewhere in the near future. The reason I bring this up is because we've talked in other episodes with physicians that have been on our show, and it shows that insulin resistance and diabetes are a two-way street with oral bacteria. It makes them flourish more or grow better, and it makes them more aggressive. It can increase the problems with gum health. It can penetrate into the bone, cause them to cause bone loss, tooth loss, and escalate diabetes and insulin-resistant issues. So not only should we worry about women with PCOS, but their brothers as well, and then the long-term ramifications that the ebb and flow of diabetes and gum disease play a part on each other throughout their lifetime.
Dr. Rogers, it seems like these pregnancy complications can lead to post-pregnancy medical complications, not only for the baby, but for the mother as well. So if any of these pregnancy conditions occur, does that mean a heart attack, stroke, insulin resistance, or diabetes that you talked about is a definite in the mother's future?
April, that's a really great question. The short answer is no. The more detailed answer is just because you have PCOS, had preeclampsia, gestational diabetes, miscarriages, preterm births, doesn't mean you have been given a life sentence of potentially life-threatening medical conditions such as heart attack, stroke, diabetes, etc. With proper oral care, exercise, eating sensibly, avoiding sugars and carbs, not smoking, drinking, alcohol, taking drugs, proper nutrition, all of these things factor into how you can avoid going down the road in the future of having these other issues occur.
Thank you, Dr. Rogers. That was wonderful information, and I'm sure it's very helpful to our listeners out there. If you're childbearing age, pregnant, or planning to become pregnant, give us a call at 570-253-5000 to schedule your comprehensive exam and x-rays to make sure you are in tip-top shape to start your family. Before we go, here's a quick update on Christine Lewis, our Complete Health Butterfly. Christine visited Lynn's Healing Zone for a light therapy session to heal her muscles. She's at the gym 5 times every week, sometimes twice a day. And she's been using the infrared sauna at Apple Day Spa every day. Christine's transformation is coming along beautifully. Tune in every week to Complete Health with Dr. Mike Rogers for updates on Christine Lewis, our Complete Health Butterfly. You've been listening to Complete Health with Dr. Mike Rogers.
Complete Health Dentistry, transforming your health for a lifetime.